there. Let's talk about something important. Sexually transmitted infections, or STIs. Whether you're sexually active or just learning about sexual health, this information is for everyone. The more you know, the more confidently you can protect yourself and others. What are STIs? STIs are infections that are passed from one person to another during sexual contact. This includes vaginal, anal, and oral sex. Some can also be spread through skin-to-skin contact, sharing sex toys, or during childbirth or pregnancy. There are many types of STIs, some caused by bacteria, some by viruses, and others by parasites. And here's the tricky part. Most STIs don't show symptoms at all, which means you or your partner might not even know you're infected. That's why regular testing is so important, because the most common symptom is no symptom. Disclaimer. Before we get started, I need to give you a quick heads up. You're going to see some graphic images during this lesson. I know they won't be fun to look at, but it's important that you understand what these possible symptoms can look like. That way, if you ever notice them on yourself or on someone you're thinking about being sexually active with, you'll recognize them right away. You might not ever forget what you see, but that's kind of the point. It helps you stay informed and protect yourself. This is why many health experts recommend that when you reach that point in your life, when you're ready to have sex with a new partner, you do so with the lights on. Being able to visually check for anything unusual is an important part of sexual safety. Finally, always have an honest conversation with your potential partner beforehand. Ask if they've been tested, when their last test was, and whether they're currently sexually active with anyone else. Chlamydia. Chlamydia is a bacterial infection and one of the most common STIs. It can be transmitted during vaginal, anal, or oral sex, and it's often called a silent disease because most people don't notice any symptoms. When symptoms do show up, they can include vaginal or penile discharge, pain when peeing, lower abdominal or back pain, nausea or fever, pain during sex, or bleeding between periods. If left untreated, especially in people with a uterus, it can cause serious health problems like pelvic inflammatory disease, infertility, and ectopic pregnancy. It can also infect the rectum and throat, and in rare cases lead to a type of arthritis called Reiter's syndrome. Testing is simple: a urine test or a swab during an exam. Treatment is easy: antibiotics, usually doxycycline. All sexual partners need to be treated, and it's important to avoid sex for 7 days after finishing treatment. Gonorrhea. Gonorrhea is also a bacterial infection and is the second most reported STI in the U.S. It infects mucous membranes, like those in the urethra, cervix, rectum, throat, and eyes. Many people who have a penis and are infected with gonorrhea are asymptomatic, meaning they have no symptoms. Signs and symptoms of urethral infection in people with a penis may include pain or difficulty urinating, white, yellow, or green discharge from their penis, testicular or scrotal pain. It can also infect the mucous membranes of the mouth, throat, eyes, and anus. Infections in the throat may cause a sore throat. Symptoms of rectal infection in all genders may include discharge, anal itching, soreness, bleeding, or painful bowel movements, or there may be no symptoms. Many people with a vagina who are infected with gonorrhea may also be asymptomatic. If they have symptoms, they may mistake it for a bladder infection. Initial symptoms can include a painful or burning sensation when urinating, increased vaginal discharge, vaginal bleeding between periods. Untreated gonorrhea can cause serious and permanent health problems in all genders and increase a person's risk of acquiring or transmitting HIV. But again, many people show no symptoms. If left untreated, gonorrhea can cause permanent damage to the reproductive organs or spread to blood or joints. Testing is done through urine or swabs of the genitals, throat, or rectum. Treatment involves antibiotics. But some strains are becoming resistant to medications, so always take all your meds exactly as prescribed. Partners need to be notified and treated, and no sexual activity until treatment is complete. Trichomoniasis. Trichomoniasis, or trich, is a very common STI caused by a parasite. It can be passed between any combination of partners through genital contact or shared sex toys. Most people have no symptoms, but it can increase the risk of pregnancy complications or HIV. People with penises may experience itching inside the penis, burning after urination or ejaculation, or penile discharge. People with vaginas may notice itching, burning, redness, or soreness, discomfort during urination, or unusual vaginal discharge, sometimes with a fishy smell. They could also have pain during sex. Testing is done using urine, vaginal fluid, or discharge. Treatment is antibiotics. And if the sexual relationship is going to continue with the same partner, to avoid recurrence and a continual infection being passed back and forth, both partners must be treated at the same time. No sex until symptoms are gone and treatment is finished. Syphilis. Syphilis is caused by a bacterium called Treponema pallidum. It's spread through direct contact with syphilis sores, often during vaginal, anal, or oral sex. It can also be passed during pregnancy and lead to stillbirth or serious birth complications. Syphilis comes in 4 stages. Primary stage. In the primary stage, a sore called a chancre appears at the site of infection. There can be 1 or more. They are round, firm, and painless. The sores heal on their own, but the infection is still there. Secondary stage. During the secondary stage, skin rashes may appear on the hands and feet. Sores in the mouth, anus, or genitals may also occur. Other symptoms may include flu-like symptoms, hair loss, fatigue, and muscle aches. Latent stage. In the latent stage, there are no symptoms, but the infection remains in the body. Tertiary stage. Lastly, the tertiary stage can occur 10 to 30 years later. In this stage, there may be damage to the brain, nerves, heart, eyes, liver, bones, and more. It can lead to blindness, dementia, and even death. Testing is done with a blood test. Treatment is antibiotics, but it won't reverse damage already done. Early testing and notifying partners is key. Genital herpes. Genital herpes is caused by 2 types of herpes simplex virus, HSV1 and HSV2. It's very common. About 1 in 6 people aged 14 to 49 in the U.S. have it. It's spread through vaginal, anal, or oral sex, even when no symptoms are present. Symptoms include blisters or sores on the genitals, anus, or mouth, itching, redness, or irritation, flu-like symptoms during the first outbreak. Repeat outbreaks are common in the first year, but tend to decrease over time. The virus stays in your body permanently. Condoms help to lower the risk of transmission, but are not 100% effective. There is no cure, but antiviral medications can help reduce outbreaks and lower the risk of transmission. Even without visible sores, herpes can still be passed to others. Using condoms, avoiding sex during outbreaks, and hand washing are important prevention steps. HIV, human immunodeficiency virus. HIV attacks the immune system, specifically CD4 T cells, which help fight off infections. It is spread through blood, semen, and preseminal fluid, vaginal and rectal fluids, breast milk, or during childbirth or pregnancy. Symptoms often start 2 to 4 weeks after infection and may include flu-like illness, rash, night sweats, swollen glands, weight loss, or mouth ulcers. Or sometimes there are no symptoms at all. Testing is the only way to know. Everyone ages 13 to 64 should get tested at least once. If you're at higher risk, testing every 3 to 6 months is recommended. Prevention includes using condoms every time, never sharing needles, taking PrEP before exposure or PEP after exposure. If HIV positive, taking antiretroviral treatment, or ART, can lower the virus to undetectable levels, which means it can't be passed to others. HPV, human papillomavirus. HPV is the most common STI in the United States. There are over 170 types, and 40 affect the genital area. Most people don't know they have it. It spreads through vaginal, anal, and oral sex, and even skin-to-skin genital contact. It can cause genital warts, throat warts in rare cases, cancers of the cervix, vagina, vulva, penis, anus, and throat. Warts can go away, stay the same, or grow. Some HPV-related cancers may not show symptoms until they are advanced. There's no cure for HPV, but there is a vaccine. The HPV vaccine is recommended at ages 11 to 12 and be given as early as age 9. It's most effective before any sexual contact. Even though condoms don't cover all the skin areas where HPV spreads, they still help reduce the risk. Quick STI facts. Let's clear up some common questions. The most common STI symptom? No symptoms. Can sex toys spread STIs? Yes, if they aren't cleaned properly or are shared. Which STIs can be cured with antibiotics? Chlamydia, gonorrhea, syphilis, and trichomoniasis. What's the most common STI overall? HPV. Key takeaways. Most STIs have no symptoms, so regular testing matters. Condoms, when used correctly and every time, reduce the risk of nearly every STI. Many STIs are curable, and the rest are treatable. Knowing your STI status and your partner's is one of the smartest choices you can make. HPV vaccines, PrEP and PEP for HIV, and early treatment make a big difference.
Final thoughts. Being informed doesn't just protect you, it protects your future partners too. STIs are part of sexual health, not a reason for shame or silence. Knowing the facts, using protection, and getting tested are signs of respect for yourself and others. Thanks for sticking with us. Stay smart, stay safe, and take care of your health.